We're going to talk about disorders of the female reproductive system, starting with disorders of the uterus and cervix. So the first disorder we're going to talk about is fibroid tumors, very common benign tumor called a leiomyoma. Uh, it really is a smooth muscle, benign growth. A lot of women have them. It's probably one of the leading causes of hysterectomy. These things take up a lot of space potentially. Um, they they can be microscopic and just incidental findings, or they can be huge. They can be the size of a grapefruit. So, and everything in between. The problem that they cause is really depends on where they are. So, uh, in this picture, what it's showing is in the walls of the uterus, in the smooth muscle walls of the uterus, you can see that there's basically three positions of them. Uh, uh, One is submucosal, so it's very close to the lumen of the uterus, and what it can cause is bleeding into the uterus. It's, a lot of them are intramural, which means that they're right in the middle. Some of them can extend into the submucosa, but usually they just stay put in the walls. And they basically just take up a lot of space. The other type, and that is called subserosal, and they're near the outside of the uterine wall, just under the serous membrane. And their basic problem is how much space they take up. You can see that this particular one in this drawing is huge, and it's putting pressure against the colon and just above the rectum. Um, so uh, yeah, this is the problem with them. Sometimes they can push down on the bladder, that kind of thing. It's the space that they take up. Uh, they they're saying that it's probably 80% of women in childbearing years. You know, they're stimulated by estrogen. Uh, they kind of go away postmenopausally. And so these are these are growths in premenopausal, post puberty women. I think 80% is probably high. All these are guesses. They kind of look at the incidental findings and kind of extrapolate from there. But who knows? Um, Etiology, here's a surprise, probably a combination of genetics, environment, and hormones. Sounds like just about everything, doesn't it? So if they're right next to the lumen, submucosal; if they're in the middle, intramural; and if they're near the outside, they're subserosal. Uh, what happens is that it's almost like this scar tissue starts to grow. Um, and it is interesting. Keloid scars in the skin, and these have the same kind of collagen disorganization. And it's interesting that African Americans are prone to both keloids and fibroids, so they're probably somehow related. Uh, Probably no signs and symptoms unless they get big enough to start pressing on things. So they can press on nerves, they can press on the bladder, they can press on the bowels. Uh, they can interfere with pregnancy if they're taking up space, then the uterus can't grow to accommodate the baby. Um, if they are submucosal, they can cause really heavy, painful periods because what'll happen is the at menstruation, the presence of this just below the surface causes more vascularization, more bleeding. Uh, so that's a lot of times that's how they're found, because of looking for the causes of heavy periods. Uh, don't usually cause seriousness. Because of the loss of blood, they can cause anemia. Uh, they can cause infertility. If there's a peduncle on them, they can twist and torsion and end up dying. Right? Or they can grow so fast that they outgrow their blood supply and therefore become necrotic. They die. Um, and having necrotic tissue is never a good idea. Um, Sometimes they are found through palpation when they're doing a pelvic exam. When they as they're doing the digital cervical exam, a standard procedure, I believe, is to push down, to put some pressure on the abdomen to move the uterus down and move the cervix down, uh, to kind of back up your palpating hand, and the lump is felt there. They find them a lot just as incidental findings on MRIs or pelvic ultrasounds. Um, so what do they do with them? Probably nothing for a lot of them. Sometimes they give hormones. They try progesterone. Will do it. Uh, the Sometimes they try and freeze it off. That's what the cryomyolysis is. So that means freezing the muscle tissue until it's gone. Um, they they'll burn them off with a laser. They will try and do some surgery and take them off, or, like I said, they're a big cause of hysterectomy. Uh, yeah, very common. Um, as far as massage goes, they're a local contraindication, but generally speaking, they're not anything to be terribly worried about. Like I say, very common. More, you should just be knowledgeable about them because so many people have them. And young women don't tend to know that much about them, but by the time you reach your 40s, it probably becomes conversation because so many people have them. You just become generally more aware. Ask your mothers about them. They probably will be able to give you lots of insight.